For various reasons, the coronary arteries become narrowed and the heart muscle no longer receives enough oxygen and nutrients, which leads to the development of coronary heart disease and its symptoms. In the United States, about 3 to 4 million people have coronary heart disease without showing any symptoms. There are 7 main factors that cause coronary heart disease. Number 1 is high blood pressure. Number 2 is high cholesterol. Number 3 is smoking. Number 4 is diabetes. Number 5 is stress. Number 6 is obesity. Number 7 is physical inactivity and sedentary work. Due to the diseases and causes I have just mentioned, plaque builds up on the inner walls of the arteries, thickening the walls of the arteries and narrowing the arteries. The plaque that builds up on the inner walls of the arteries contains cholesterol, calcium, dead cells, and blood clots. The plaque that builds up on the inner walls of the arteries gradually hardens. Sometimes, these plaques break off from the walls of the arteries and get stuck somewhere in the body's arteries. If they get stuck in the heart arteries, they can cause heart failure. If they get stuck in the brain arteries, they can cause stroke, and if they get stuck in the arteries in the limbs, they can cause pain and numbness. Symptoms of coronary artery disease are: Number 1 is angina pectoris. Angina pectoris is a condition where the blood vessels of the heart become narrow and the heart does not receive enough blood supply, which is essential for the heart. Number 2 is a feeling of tightness in the middle of the chest. Number 3 is a feeling of heaviness in the body. Number 4 is heartburn. Number 5 is pain that spreads to the left shoulder, left arm, neck, and jaw. Number 6 is rapid breathing. Number 7 is a feeling of shortness of breath or difficulty breathing. Number 8 is dizziness. Number 9 is nausea and vomiting. Number 10 is excessive sweating. Chest pain can also be caused by sudden movements or exertion and usually lasts from 30 seconds to 5 minutes. If chest pain does not go away and gets worse, it can lead to a heart attack or stroke. There are several ways to test for coronary artery disease. These are: Number 1 is an electrocardiogram, ECG. 0.2 is a cardiac catheterization, in which a small tube is inserted through a vein in the leg or arm into the heart, and then a dye is injected into it and an X-ray is taken. Number 3 is a chest X-ray to check the condition of the heart. 0.4 is a cholesterol test. Number 5 is diabetes screening. You need to take the medicine for coronary heart disease exactly as your doctor has prescribed. The medicines for coronary heart disease are: Number 1 is nitroglycerin, which is in the nitrate group. 0.2 is in the beta blockers group, propranolol metoprolol 1. Number 3 is in the calcium channel blocker group, amlodipine and diltiazem. The 3 medicines I have mentioned now can best control the heart rate and oxygen demand. 0.4 is a medicine that prevents blood clotting, which is Aspirate, which is in the aspirin group. 0.5 is atorvastatin, which is in the statins group, which lowers blood cholesterol. The drugs I am going to talk about now are drugs that help to normalize the blood vessels in the heart for patients with coronary artery disease. As for surgery, Number 1 is the method of surgically opening and connecting the coronary arteries called coronary bypass surgery, and Number 2 is the method of connecting the blocked heart arteries called coronary bypass graft. There are some behaviors and methods that must be followed to prevent coronary artery disease. These are: Number 1 is to avoid foods rich in cholesterol such as animal fats, beef, pork, goat meat, eggs, unpasteurized milk and dairy products. 0.2 is to eat enough vegetables and fruits, unpasteurized milk, fish, poultry, wheat, corn, etc. Number 3 is to completely avoid smoking. This is because smoking greatly hinders the oxygen supply to the heart. 0.4 is to do moderate physical exercise. 0.5 is to maintain a healthy body weight. Number 6 is to avoid stress as much as possible. I believe you who have watched this video from beginning to end will understand and appreciate what I have just said. This video is enough now. This video will be stopped here. Let's meet again in the next videos. May all of you be healthy and happy. Thank you so much for your watching this video.